So in our time together today, I hope to share with you a multi-part story. I will tell you a little bit about the people that are behind this work, and then provide a little context about this country that we call the United States of America. I will also share a little bit of perspective from the ground up from Buffalo, New York, where I'm actually located. You can see the fall colors in my background. And then I will talk about what happened when COVID arrived and the community's response to COVID, with the possibility of reflecting on some lessons for way forward in our role as urban planners, but also people who might be working with local government in varied ways. I'll leave with some resources and hopefully have some time for a conversation. So no knowledge is generated without a group of people that are working hard. And I like to begin my conversations by lifting up the people behind the work. This is a pre-COVID photograph of the UB Food Lab team. And we are physically at that moment located in the School of Architecture and Planning, where my faculty appointment is. I wear two different hats. I, of course, direct my research lab called the Food Systems Planning and Healthy Communities Lab, but I also co-direct a center called the Community for Global Health Equity. So the group that you see is a combination of people that represent the food lab and my colleague, Dr. Boama, from the Community for Global Health Equity. I offer this picture to say that much of the work that you will see in today's lecture is synthesized from many different studies involving many of the individuals you see on the screen. They are from different disciplines. I understand that the seminar is interdisciplinary, so I'm pleased to share with you that in that one photograph in front of you stand people who are trained in real estate development, architecture, urban planning, public health, dietetics, public policy, and a whole variety of other disciplines. We don't quite look the same way today. So in post-COVID times, we are all remote, but really excited to join you all through my voice in this conversation. Many of my lab members are, in fact, I believe in the call, including some alums from Food Lab from before. Nice to see you all. Okay. So the Food Lab does three things. We, of course, focus on the role of people in city, regional, and subnational government planning and policy, but we really see food system as a lever for broader social transformation. While I care very much about what people eat, I'm much more interested in why they get to eat what they eat, who controls their food system, who decides what kind of policy is appropriate for them. We work in three areas or three ways. We train students in the lab, of course, we do research, but a key element of our work is to translate that work into policy. I will primarily focus on research today. Give you a little sense of the geography that we work in, but also will be drawing from. To clarify, my comments around policy are all very much at subnational scale. So in the US, that would mean city government, county government, but I understand that in the UK, the terms might be different. So just for cross-country translation, we're talking about subnational scale. That does not mean that country level policy is not important. In fact, lately it seems that national policies are being designed to decimate local policies, but we can come back to that in the discussion. We definitely work in the United States, but I also work in Kashmir, which is a region in conflict and occupied, as well as other global South communities, and happy to talk about them later. We tend to, the work that you will hear from is really through documentation of innovation across the United States. On the map that you see are orange blocks of cities that we have pulled data from to understand what is happening. So we kind of look at what's happening across the country, but we do deep dive into a few places where we have a role in capacity building. So one example of innovation is the city of Baltimore, for example, has been able to respond to COVID and the pandemic in large part because of innovation that they have had for several years around food systems, and I'll touch on that. So we also, as I said, do work on capacity building, and right now on the map, you are seeing the area where we're doing most of our capacity building, and I'll talk about this particular region. So given that background about me and the team, some of whom are on the call, let me step outside of Buffalo, New York, where we will spend a good portion of our time together to give you a sense of the planning landscape in the United States. I understand that outside of the US, in Great Britain, and in other countries, urban planning looks quite different than it does in the United States. I've often heard the term spatial planning when people talk about urban planning in the UK. In the United States, it's a little bit different. Spatial planning is certainly a component, but planners also engage in a variety of other activities, and I will talk about that shortly. So in the United States, the largest association of planners, American Planning Association, about 40,000 members. This is kind of one of their statements about what they think planning means. Planners aspire for equitable places. They aspire for healthful places. They aspire for places that are attractive for present and future generations. In other words, planning is about creating the conditions in which people thrive. We very much think spatially, but we're also very future oriented and very much about making sure that people thrive. Given that condition, it begs the question, where does food fit in? And do planners really think about food the way they think about transportation, the way they think about housing, the way they might think about laying down of sewer lines? That's a very good question. When I talk about food, when I answer this question and walk you through the national landscape, I'll be referring to what will seem like a very familiar food supply chain. Thanks to COVID, now everybody in my family knows what a food supply chain is. But here's what I'm talking about. And in terms of planning, I would argue that planning touches every bit of that food supply chain, where food grows, how it gets moved from one place to another, and then ultimately, how do people eat it? This systemic view might be clear to Dr. Krissinger, to myself, to others who work in food, but regrettably not so much to our policymakers. When they are talking about whether children have food to eat, they're not necessarily thinking about the connections to other parts of the system. In the United States, the policies that impact these sectors have a particular appearance and particular authority. There are these things called official plans, which might be called master plans or strategic plans in the UK context. But in the United States, they're just called plans. We also have implementation tools that actually translate those plans into action through regulations, through finance, through physical infrastructure. All of these activities impact whether communities are prepared for a pandemic like COVID or not. And I'll come back to that later. So several years ago, actually 2014, it seems like a lifetime ago, pre-COVID, we did a national survey of American Planning Association membership and asked them what they thought about food. How central was the food to planning work? Given that planners' charge is to create communities where people thrive, do planners actually think about the thing that makes our life itself possible, which is food? And the responses from the survey, you can see where they came from across the United States, some more in particular parts of the country, Seattle, and some other portions. But here's the sad news. In a nutshell, what we learned was that 1% of planners reported that their local government views food systems as a priority. So it is not, was not, I should say, a top priority. I'll come back to how that perception has changed. From not being a top priority, we have found new language today to describe food systems. Suddenly in United States, food systems is essential infrastructure. Food workers are essential workers. But the background, the context within which we operate is that we never viewed food systems as a public infrastructure. But we asked planners in 2014, well, how are you engaging? Some of you are. So about 300 some said we are engaging in food system. And the graph that you're looking at, it actually shows how planners implement policies. At the bottom is zoning, which in the United States, I believe is called UK is called zoning bylaws. Here we call it zoning ordinance. So zoning ordinances are common. And then if you go up the graph, you'll see that there's not a lot of incentive or grants or bonuses for food. In other words, regulation, not investment, is the primary point of entry for planners in the food system in the United States. So when we ask them, well, why don't you pay attention to food? We ask planners this. At the bottom, what they're saying is we have limited public resources. That's where the orange band is the widest. And if you go up to the top, the narrowest orange band is limited community support for food systems. In other words, if you flip that around, planners understand that community wants food. In fact, when we had open-ended interviews with planners, food is a top public priority item. It's what community members talk about. It's what poor residents talk about. I understand in the United Kingdom, one of your football players has been talking about free school meals for children. So people who have lived experience understand how central food is, but somehow local governments decide that they do not have the funding for it. But let me point out an irony right now in the United States. Our local government budget spends more on police, which we oddly call public safety, rather than on food. So in a summary, to give you a recap of the national landscape, there is limited engagement in 2014 in food systems planning by local government representatives. There was interest, but limited engagement. There was also limited awareness and reportedly lack of public funding. When they did engage, it was through regulation, not through investment. And even though planners in the US have a wide suite of tools, there's very limited engagement. The one that we like to use is zoning. Where can you grow food? Where cannot you grow food? Where can urban agriculture exist? Where can it not exist? So that's the national context for food systems planning. There's a lot more detail, but I think this gives you a picture about how central policy, local government policy views food, which is pretty dismal. Okay, but the perspective from the ground up is quite different. I'm taking you into the second part of my story here. Perspective from the ground up comes from, I'm going to take you to one particular part of New York State, back to Buffalo, New York. And for those of you unfamiliar with the geography of the United States, let me reassure you, there is a thing called New York State, which is different than New York City. New York City is located in New York State, but I assure you that those of us who live in New York State do not wish to be confused with New York City. So right here on the top right is New York State. New York City is somewhere in this corner, and I am going to take you to the left top corner of New York. We are a border city, believe it or not. This is Canada north of us. And on the banks of, or the shores of, what are the Great Lakes of the United States, an incredible freshwater reserve. And the city of Buffalo is actually located right there, a short drive from Niagara Falls. Okay, so within Buffalo, a few deep dive items. First, it's the second largest city in New York State after New York City. Of course, the difference in size is colossal. We're we're about 250,000 people. But what's important for everybody to know is that Buffalo is a Rust Belt city. At one point, we had 500,000 people here. And along those shoreline that I showed you, at one point, grain from the center part of the United States would come through the shoreline, get up on a canal, which locally is called Erie Canal, get shipped out to the eastern seaboard of the country, to the United Kingdom and other parts of the world. In fact, buffalo played a role in the global food system before we knew the term global food system existed. At one point in its heydays, you had so much grain traveling through that port that you could feed Americans bread today all year. That was the volume of grain passing through. So we were a steel town. We had incredible grain mills along the shores. Today, however, we are not that. We are a city that has incredible challenges. We are one of the most segregated cities in the United States. We are about 36% African American or Black, 47% white, and in parentheses are numbers for the United States, so you get a little bit of comparison. Median household income is about 35,000. All that to say, things aren't great. But what I want to draw your attention to is the animation that I hope will show up shortly on your screen, which is effectively a dividing line within the city of Buffalo. On the right side is what we would call the eastern end of Buffalo. Some call it the east side. Our preference is to call it East Buffalo, where you have lower income, you have limited investment, and you have a higher proportion of communities of color. One piece that it's important to understand the historic context is that this is not a new condition. This is a condition that has existed since the Black community moved up north seeking new opportunities to escape Jim Crow laws, but also city of Buffalo was one of the places on the Underground Railroad as enslaved Black Americans fled slavery in the United States to Canada. This particular portion of the picture that you're seeing on the right side is also the place where at one time deeds on houses would be such covenants that Black people could not buy homes. Banks would redline this area, which means that they had a criteria for not lending to people living in this area, which is predominantly Black people. So our historic Black community has experienced successive generations of disinvestment. So to look at this place today and not recognize that historic context is one of the most egregious errors of urban planning, and I would argue of food policy. So I'll come back to this again and again, but I ask you to keep your attention on the eastern end of the map, which is our historically African-American community, also called the East Side. When we move forward, you can see those racial patterns that I mentioned to you. So income is, investments are lower on that side, but of course the color, darker color signals that a greater proportion of minority marginalized people live on the East Side. What does that mean in terms of the food system? If you look at predominantly white neighborhoods in our area, this data is actually from a regression equation, but I understand people don't like regression equations in a seminar on Zoom, so you don't get that. So in white neighborhoods, the prevalence of supermarkets and grocery stores looks like this. And then the prevalence of supermarkets and grocery stores in Black neighborhoods looks like this. I will reference the regression equation to say that this data is controlled for wealth. This data is controlled for land size and population size. In other words, this is not, and I beg your forgiveness here, do not use the term food desert to describe this condition. I insist that this is a condition in the United States that many community leaders have referred to as food apartheid. If you look at convenience stores, which are, it's kind of a weird name for them in the United States. They are convenient because they're near you, but they're not convenient for your health because they sell trash most of the time. well, they sell some other things too. But if you look at their prevalence in white neighborhoods, this is what it looks like. And then if you go to Black neighborhoods, the prevalence increases. So you have Black populations and brown populations that are trapped in neighborhoods with very limited access to food. Um, just I point this out to signal this is where COVID arrived. Okay, so all of this that I have shared with you is based on a timeline of work. I will come back to this timeline. I bring this timeline to draw your attention to green on the top, orange on the bottom. Don't worry about the details. The point is that civil society actions way back from the 90s all the way to now, 2019, actually, we're in 2020, but time warp. Lot has been happening that has been done by people. And I draw your attention to the first the most latest comprehensive master plan by the city in 2006. And the term I use to define it is food blind. So we have a master plan. It's not that urban plans don't exist, but literally in this plan, there is no discussion of any of this activity or the needs or experiences of Black neighborhoods vis-a-vis food. Then, because of pressure from this community, a whole series of policies get adopted that I can talk about later, something we love to call the chicken ordinance. You'll hear about that, new zoning bylaws, etc. But to set all of that policy aside, let me give you a feel for the city and for the work of the community. So here is in the city. Remember I said that the city had about 500,000 people at one day, but now we are about 250,000. So density has dropped. We have about 15,000 vacant lots. And the children here, or youth, I beg your pardon, the youth that are standing here have taken over a vacant lot and turned it into a farm. So we have many of such activities unfolding. This is on the bottom left. I'm lifting up the organization that is responsible for this work. So today we have more than 100 community gardens and more than 5 functioning urban farms in the city. And I'll talk more about that. So the youth also sell this food, they prepare it, they made sure that their work actually got into a grocery store, it's retailed. And importantly, they recognize that the food policy landscape is blind to their aspirations and lived experience. So these are 2 young people. This is from 2011, arguing about their vision for what Buffalo ought to look like. By the way, this happened in the context of the city doing a zoning code revision, and Jordan and Adriana were part of the team that led neighborhood workshops, encouraging residents to understand what a food-sensitive zoning code might look like. The 2 fine people don't look like that anymore because Adriana is a social worker, finished graduate school. Jordan is grown up. This is a long time ago. Another example is that people on the ground insist on ownership, not on handouts, not on charity, but on ownership of the food system itself, so that the money generated from food systems circulates back into the economy. This is a picture from an immigrant food incubator run by an organization called West Side Economic Development Initiative that trains immigrants to have to lift up their food skills and actually become entrepreneurs. We have a Somali Bantu owned operated farm. This is an older picture. There's been some progress on this, which we can talk about later. But remember, this is all pre-COVID. And then importantly, this is a picture from June 2019. A coalition of Black and Brown and Indigenous people gathered and established what's called a Food Equity Network, led by Rebecca Williams of Food for the Spirit organization locally. And they are not a not-for-profit, but insist on collaborating and building relationships to promote food sovereignty, ownership over the food system. So this is happening all the way up to 2019. So I've walked you through a couple of decades of food work in the city. What does that mean? That means in 2019, on the left side, community organizations, actually this map is from 2018. The red areas are where community members identified in partnership with the UB Food Lab areas that needed attention. On the right side is a map of actual projects that were developed but within 2 years, 2018 and 2019. And you could, the details aren't important. The point is that they are all concentrated in the area that I had pointed out earlier as a high need area. So that's the action that is happening in the community. Prior to COVID, I'm heading off to my third part and the final part of the story. I'm gonna do a little time check. Okay, good. The third part of the story is, I suppose, a metaphor for what is happening in our world, in our countries, in our neighborhoods, that we have multiple worlds down into our neighborhood. And those multiple worlds view different policy trajectories. So I'm going to begin by first telling you when COVID arrived, what did it look like? COVID arrived, and immediately we learned that comorbidities are important, that it may hit everybody, but the outcome won't be the same. And you will now recognize that as soon as we heard this, community partners were immediately concerned about the East Side because we have limited diet access, limited income, limited healthcare, limited every social and environmental determinant of health is impacted on the East Side. So even before, as the COVID stories were unfolding, a community leader I spoke with yesterday, Rita Hubbard Robinson, said that as soon as she heard about this comorbidity business, she was on the phone calling people and saying, this is the area we need to be focused on. Because comorbidities have a localized spatial pattern, it's nonsense to say that COVID impacts everyone the same way. I am sorry. It's just the most illogical statement that is coming out up and down in policy realms. Yes, we're all affected some way, but the outcomes are not the same. So there are high-risk clusters, and I am sorry to say that the incidence, in fact, was in 14215 zip code on the top right. And I'll come back to that. So that's how COVID arrived. And at the same time, it was also a condition where people did not have access to vehicles. So this is a vehicle ownership map in Buffalo. So if you have darker green, you have higher percentage of households without vehicles. So this neighborhood, for example, high comorbidity, low vehicle ownership, all around cumulative burdens. But on the other hand, here's what the public policy response was. Transformation of language. We started calling food workers as frontline workers. Not me. I actually woke up one morning and thought, well, did somebody read my paper from 10 years ago? Nope. We had just discovered that because we actually need food to eat, and grocery store workers are frontline workers. Keep in mind that in Buffalo, most of those frontline workers are also Black and brown people. Farm workers are Black and brown and immigrant people. So we somehow catapulted and transformed our attention to frontline workers, not because we think about them, but because they serve the larger society. Publicly, we also became aware of this thing called the food supply chain. And suddenly there was interest in buying local as people were shut in. So back to that timeline that I skipped over. The blue dot is the arrival of COVID. So I would argue that we were not ready from a public policy point of view to think about how to respond to food. And yet, there was all this activity on the community front. So this is now the community response I'm pointing out. The community did not have to stumble because they had spent years building relational infrastructure. So what happened within a very short period of time, something called Seeding Resilience emerged with 80+ members. So you have urban farmers, you have grocery store, food pantries, you have all kinds of people joining this phone call that I will talk about. So community's response was to draw on its relational infrastructure, and that term is key here. The second point is there was rapid mobilization. I have to call out Rebecca Williams here. Um, she is a community facilitator, a connector, she's many things, but within short period, I was getting flooded with phone calls, texts, flurries of texts is what I call it. Um, and talking about what are we going to do, especially about the racial distribution patterns. Very quickly, Seeding Resilience formed, which is a coalition, no formal structure, with three goals. Let's distribute food from our local distribution system. Let's increase production on existing farms, and then help people set up farm gardens in front yards and backyards. Ultimately, also create job and employment opportunities in the food system, in building garden beds, in farming, in moving food around, all kinds of activities that are tied to the food system. Those were the goals. And then I was trying to remember, I'll go back to the timeline shortly. But those were the goals of this group. And you can see that many of the, I would say all of the people who were kind of the backbone of this coalition were people who had been doing this for years. This was relational infrastructure that enabled the coalition to form within a short time. And one example of that that I will come back to was this incredible effort by one of our Black leaders, Miss Gail Wells, to launch what became, she gave it the name of Freedom Gardens, recognizing that this is not about, again, about waiting for somebody to fix their problems. You saw how long people feel their neighborhoods have been ignored. And she took the lead on establishing this, which I'll talk about shortly. I don't know if Miss Gail is on the call, but she knows that I'm talking about her. The other thing that happened as a community response was resource aggregation. I mentioned the data calls. Rebecca Williams pointed out, she said to me one day, she said, you know, Obama during Ebola had these data calls that I attended. So let's call them data calls. And my researcher had said, no, we can't call them data calls. We don't have data. Let's call it something else. We couldn't agree on a name. It kept getting called data calls. We met weekly, then monthly. And now it's less frequent. But what happened because of those data calls is that people started talking to each other about moving food to pantries. One day a farmer called and I said, I have so much, what was the produce? Oh, it was head lettuce. He said, I have so much head lettuce that I cannot harvest because I don't even know why they couldn't harvest it. But we were able to move it into cold storage, get it out into food pantries. This was also the time of Ramadan for Muslim families. And so one of our local leaders established a halal food pantry and got the food out to our refugee families and our Muslim families that were fasting. So a time that would be really risky turned out to be a time of celebration and connection. Then myself and the lab was getting asks for information. And it occurred to me that we have all this data lying in our GIS database about food sources. Let's get it up fast. And the fastest thing that we could do, literally within 48 hours or something like that, was to put up a Google map of aggregated food resources for Seeding Resilience. And the beautiful thing about this was that once the lab put the map up, people were sending us locations to add. So it kind of automatically became a people-sourced map. And then we were fortunate to get some seed funding from a local foundation, $50,000, that propelled the work forward. And I'm happy to talk about that more in a second. So the last point that I want to make here on the community response is the community, everybody who joined the Seeding Resilience call, the Buffalo Food Equity Network, which is a caucus space, virtual caucus space for Black and Brown and Indigenous leaders working in the food space. Everybody seemed to be really clear about the difference between acute and long-term response. So there was an interest in rapid deployment of food. I mean, that's actually what happened. We had somebody who joined a Seeding Resilience phone call and told everybody about safe grocery pickup and drop off, safe food pickup and drop off. Then there was redistribution of food. I gave the example of the lettuce head. And then the third one, which I hinted at, is that Ms. Gail Wells, with support of Grassroots Gardens of Western New York, which is mentioned in the article that is connected to my comments today, launched an application with Rebecca for setting up these front yard, backyard gardens. And the idea was that we would set up 50 home gardens. That's actually Miss Gail in around garden beds. And this is newspaper in the community that is very focused on the Black community and actually operated by a Black leader in the community. So anyway, Freedom Gardens were launched, and I printed this recently, but the announcement was, in the spring after COVID. But what was remarkable was the number of requests for the application far exceeded what the coalition was able to do for the families. And this is a map of where Miss Gail directed the Freedom Gardens and helped shepherd them up. So you can see there's a very intentional purposeful path for reaching people who were at risk. So why do I tell that story? Well, let me go back first. Let me stay here for a second. So all of this is happening in a short period of time, April, May, June. The beds are in place, the applications have gone out. In the same time, I won't name the agency, but a public agency contacted me and said, we have all this resource. It could have been food or money. I'm not going to name the resource. They have all this resource that they want to send out, but they don't know how to reach people. And nobody's using their resources. This is through the public policy program systems. And it occurred to me at that moment in time, there is a difference between scale and networks. I mean, we know this already, but it was a very poignant example of there are public programs that can do scaled up work, but they can keep hitting the wrong target. They will never reach the people that they are supposed to reach. So I understand that there is a desire in the UK to have more school food support, and I hope that moves forward. To that, I would supplement by saying, no matter how great a school food program is, no matter how great supplemental income programs are, if they are not dovetailing with community infrastructure and community networks, we will keep developing inefficient programs and missing the target. So more on that later. So what's the way forward? I'm going to pause, take a breath here. In a nutshell, if I had to say one thing, it's that what COVID taught us is really that there are existing inequities that get amplified by crises like COVID. COVID has amplified them for Black, Brown, and Indigenous people, at least in the United States, at least in Buffalo. That's not the case that all crises will impact the same people. For example, in war-torn areas, women and children are often at risk. We can talk about many other groups of people. But here, what COVID has illustrated is that the inequities, structural inequities experienced by a group of people were just amplified. And of course, as many of you probably know, this year, unfortunately, the country also woke up to the continual oppression of Black people at the hands of police. And what we call now, I call and my colleagues call, we are in a moment of racial uprising, which actually gives me hope. But that racial uprising also is in some ways not a new thing. So what we didn't learn from COVID, I hope the racial uprising reminds us as well, that many of these inequities and therefore are pre-existing, and therefore policies have to have a historic understanding of conditions. So what does the way forward look like? It will seem very simple. The first, I'm going to go through some challenges. The challenges are, in the context of COVID specifically, response requires activities that are not the purview of any single food organization. I told a pretty long story about Buffalo, but what I failed to say that we found it very difficult, I found it very difficult to manage the logistics of transportation, of connecting all the sectors. So our seeding resilience team was set up by sectors, but the coordination across those is pretty tough. That's also the case if you're talking about the public health department and the planning department and what a school district. So the interstitial activities between agencies, between sectors, are the ones that are the first to go in a pandemic. But those are also the first that we need back up. The second one is a challenge, that public policy at higher levels of government. Much as I hold my own city to accountable, and I'm actually really grateful that our city government has responded. One of our city staff continually showed up for our seeding resilience meeting, so I do want to shout her out. But public policy at higher levels of government, right now, federal government decimates local communities. So unfortunately, resilience is code word for let's deal with problems. You deal with problems created by someone else. So we would not be in the situation that we are if the federal government had not wrecked the COVID response at the federal level. We would not be in this situation if the federal, state, and local government had all along recognized food system as an essential infrastructure. We don't need a pandemic to remind us that we can't actually live without food. I've never met anybody who lived without food. I bet you haven't either. The third is, at this moment in time, and for some of us for a long time, the very basis of freedom and well-being is threatened by the very entity that is responsible for our well-being, the state. So in Buffalo, again, the police budget is bigger than our food budget. Freedom and well-being itself has to be reimagined to develop public policy that is thoughtful. And then the last one, no surprise, for us, unfortunately, in the United States, we have policy leaders and policy makers who do not understand the nature of evidence, who contest science itself, which made actually my life difficult during seeding resilience. For example, to facilitate drop-off of grocery from farms to different places that our community partners were doing, CDC and our federal government was giving mixed messages about masks. People were still gathering in places, and while they might be addressing food insecurity, they were getting exposed to the virus itself. So the nature of evidence is contested, but it is also contested because the government is not trusted by people. And for Black and Brown communities, regrettably, and for immigrant communities, for good reason. Okay, but not all is lost. I promise it's not all doom and gloom. After the fall, there is spring. I think one thing that we can do very clearly as urban planners and local governments and whoever works with them on this call, we have to view food systems as an essential infrastructure in cities and regions. And that doesn't mean we have to focus just on feeding people. We actually have to understand it as a system just the way we understand transportation systems, just the way we understand sewer systems. So food systems are economic engines in our county where I am. If you aggregate the contribution to our GDP, the food system is between 10 to 13% of our GDP. So it is an economic lever. So it's worth it to invest in it. The second piece, I've said this again and again, but to sum it up, in order to make investments in the recovery from pandemic going forward, which was a charge that I was given for this seminar, we have to look back in the future to look at systemic inequities and design the responses to really target those inequities. The third one, at least in the case of Buffalo, community networks were incredibly nimble to respond to the pandemic. They are a key relational infrastructure and ought to be recognized as that, along with efforts to scale up. So large scale food banks, we have them here as well, and they do incredible work. But we have to recognize how to fit these things together. And then the final thing is that it's impossible for people who neither study nor have lived experience to shape and drive public policy that would make a difference in their lives. So historically marginalized communities have to shape and drive public policy. Somebody else cannot do it on their behalf. It's just not, it doesn't actually have the impact. With that, I look forward to more conversation responding to your questions. There's a lot more in this, but one I want to share is that in the US context, there's a website where you can actually look up what local governments are doing. After I've talked all morning about what they're not doing, I do want to point out that the local governments are changing, and we have curated 200 plus policies that are food related in a searchable database that you're welcome to look at. And because I think US is a very small part of the world, there's a whole world out there. I want to point out that we also have a global searchable database of local and regional government policies in partnership with RUAF, which you can do a search on if you're in a different part of the world. You can also submit your policies that we upload here. And then you can look up what are local governments doing. I will conclude by saying the term policy might cause confusion, and I guess I should have said this upfront, but for me, it simply means a decision to act or not to act by government. With that, I thank you, and I will stop sharing my screen.